Hey guys, Dr. Heather Moore here with video 3 in our hip pain series. Thanks for tuning in. I know this is a couple of minutes of your time and you've tuned into the first 2, and now we're going to get to the exciting part of how to treat some of this hip pain at home. If you need a refresher of video 1 or 2, if you look in the email, if you got to us through an email that we sent you, they are listed in there. So if you want to go back to video 1 and look at the anatomy, video 2 we cover how to diagnose some of this at home. Now we're going to go through some of the things on what to do on how to treat it. So thank you again for tuning in. If you want to have your hip pain addressed a little bit more in depth, you can go to our free phone consult, also included in the email. And at the end of this, I'm going to go through a special offer. So tune in kind of as a thank you for tuning in. So I just want to go through a couple of things you can do at home, in the car, wherever, to make sure that you are addressing your hip pain at home. Like we talked about before, we're all short on time, we're all short on money, I get it. So a lot of people take to the at-home approach and put off addressing any of these professionally for way too long. The longer you wait till address it, the longer and the more money that's going to cost you in the long run. So while you're saving money now, popping an Advil here, ignoring it, kind of know you got something going on, but whatever, you got 50 other things going on, you'll deal with it later. That deal with it later comes at a very high cost and comes at a very, very, very expensive item, which is your time. So dealing with these things now, congratulations, you already are. You're going to start to do some things at home. If these don't seem to be helping you, like I said, we have a free phone consult with one of our PTs. You can give us a call. We'll walk you through some things and kind of go from there. So we're going to get started right now. We're going to go through 3 different things. This is stuff you can do at home. With these exercises, you can do them several times throughout the day. Probably the biggest question I get asked. Stretching, foam rolling, whatever it is you choose to do, you can do these a few times through the day. You're not lifting a load. You're not weighting yourself down. You're not applying a 45-pound bar to your back. So it's not that you need to worry about waiting that 48 hours or delayed onset muscle soreness or anything like that. You need to, you can do these throughout the day. And in fact, the more you do them, the better it's going to be. Now, when you're doing some of these, I don't mean to do them for 20 minutes, at a clip. Do a minute here, do a minute there, and then do a minute later, whatever. What I find works best is get yourself into a routine. Whatever your job is, find a spot in your day where you can include these. Let's say you are on the phone a lot. So every time you pick up the phone, you can do one of these exercises. And these exercises are meant to be done throughout the day. They are meant to be done at the desk. These are not really specialized exercises that you're going to need a ton of equipment for or a lot of space for. We're going to show you different variations, so no matter where you are, you're going to be able to do these. So the first one we're going to go through is the Piriformis Stretch. So if anybody's ever had a pain in the butt, literally, this is addressing that piriformis. I get a lot of people asking me about piriformis syndrome. This is the muscle that is afflicted when this comes into play. So we're going to show you 3 different positions that you can do to address the piriformis muscle. A lot of times you're going to notice, if you went through our last video and kind of did some self-diagnosis, this was actually a test that we used to see if there's hip issues. Now we're going to take the test, flip it around, now it's a treatment. So for this, one of the things that Sam is doing excellently, because she knows what to do, is sitting up nice and straight, okay? If you slump over, this is not going to be as effective as stretch, and you may even get into this position and be like, I don't feel anything. You want to make sure you have a nice straight back. You want to make sure your ankle is crossed over your knee. You do not need to push down on your knee. You shouldn't push down on your knee. Gravity is going to gently control your knee on the way down. But as you can see with Sam, we have a little bit of discrepancy here. This should be all the way down, and it's not. She can sit like this for a minute, which is advised. So she's on the phone, taking a conference call, whatever. She can sit here and allow gravity to go to work. This should not be painful. If this is painful, you need to discontinue this stretch. But this should be a nice, gentle stretch. 30-second hold is the minimum. but you can hold it up to a minute. We recommend doing 6 on each side, all right? And that's switching back and forth, or you can do 6 on one side, 6 on the other side. But this is the first way you can do the Piriformis stretch. This is a great stretch. Now, when you're doing this stretch, you may feel it in your butt. You may feel it out here. You may feel it in the back of your leg. It depends on which muscle is tightest. That will determine where you feel that stretch or that type of, that type of relief. If you get numbness or tingling, if you get pain, if you get pinching with this stretch, stop. All right, that's an indication that there is a very serious issue going on, and you need to address that with a medical professional right away. All right, so don't force this stretch. If you get numbness or tingling or you have severe pain, do not do this stretch. Okay, you need to get a little bit more in-depth look. That's the first way. The second way we're going to do is laying down. So Sam's going to lay down. She's going to cross her ankle over her knee, and she's going to pull her knee to her chest. Now, some of you may not get here. Some of you may only get to here. And you're like, oh, I feel a good stretch. That's fine. That's where you feel a stretch. Again, do not push down on your knee, okay? If you don't feel a stretch in this position, that's when you're going to reach your hands behind your leg and pull it up to your chest. Again, 30-second hold minimum. You want to do about a minute. Switching sides or doing 6 on one side, 6 on the other side. Whatever you prefer. You can do this in bed in the morning before you get up. This is the most effective way to do this stretch. Now, I know not all of you at work may have an office where you can lay down on the floor. No problem. So what you want to do is you want to make sure that while you're at the office, you're doing it sitting up. The other way you can do this is in standing. Okay, so you're going to find a surface, a countertop, a desk, and all you're going to do is, come over here. I'm going to have you, so we're going to do this. So as you can see, Sam is struggling a little bit with this exercise, only because she's a runner and she generally has tight hips. But the idea is you're going to put your leg up on the table, okay? Now this is the most difficult way to do this, because if you do have restrictions, like in Sam's case, it is difficult to get it up on that height, then have it rotate and all these things. So you want to make sure that you find a surface that's comfortable, or maybe that's just not a position you can handle yet, and that's okay. No problem. Just go back to the sitting or go back to the laying down. Start there. Okay? Now, if you get really good, what you want to do is in either sitting, you can go ahead and sit down, is in either sitting or in standing. So if Sam goes back into the stretch and she sits up nice and straight, doesn't feel anything, okay? What she does is she's going to sit up, make sure she's sitting up straight, and she's going to hinge forward at the hips. So it's a hinge forward. It's not a slump over, okay? If you slump over, you're not going to get any more of a stretch. You're actually going to herniate a few discs while you're doing it. So you want to sit up nice and straight and then lean forward. That's the idea, and you're going to get a nice gentle stretch either in the butt, the back of the leg, all the way down to the knee. Again, you may do this next to to someone you know. They're going to feel in a different position than that other person's going to feel it. No problem, okay? You want to feel a nice gentle stretch. It's not a no pain, no gain situation. Just be aware of that. So the next thing you're going to do is muscle release. So we have a little spike ball that we use in our clinic. Some of you use tennis balls, some of you use lacrosse balls. We find the spikes ball is the most effective of all those, only because they have spikes that literally go into the muscle. So that is going to help break up that muscle tissue that we're looking to break up. And this is a great diagnostic tool, and it's also a great treatment tool. So if you take this and you put this underneath your glute, your hamstring, like Sam's going to do, and you roll it around and you feel spots that are sore, okay, one, you've diagnosed yourself. There's some sort of muscle imbalances going on. You should be able to run that ball underneath your glute, your back, your hip, your leg, whatever, and not feel anything other than, okay, there's some spikes in my legs. What you want to do is if you feel that tender spot, you want to hold it for about 30 seconds, kind of break it up a little bit, and then move on to another spot. You want to make sure that as you're doing this, that you are holding it for no more than 30 seconds. This is where you can get yourself into trouble. Some people get these balls and they're aggressive. This is more aggressive than a tennis ball. This is more aggressive than a lacrosse ball. These have spikes in it. So you have to be aware that as you use this product, if you do it for more than 30 seconds, you can get bruising, normal. Pain, not normal. So if you do this for 20 minutes at your first get-go, you're going to put yourself into some severe pain the next day. So you want to be aware of that. You don't want to take this ball that's aggressive and really try and knock it all out. And I know that's the first thing people want to do. They say, it hurts, but it hurts really good. I know that sounds like an oxymoron. If you ever do the ball, you'll understand. But when that happens, that means that you are releasing some toxins into the body. So you want to make sure that hit a couple spots. Do this for 5 minutes, okay? Then do it for 5 minutes more, and then try it again tomorrow. All right? If you are experiencing any severe pain or numbness and tingling when you're doing this, you want to stop. But you will find some spots where you're like, ow, that hurts. As much as pressure as you put on it will reflect how much you're going to get out of it. So if you can only tolerate being leaned all the way over and just a little bit of pressure, that's okay. That's where you start. Then you slowly lower yourself down on it, okay? It may take you months to be able to actually put your full body weight on a ball like that. That's not a problem. The idea is that you're breaking up the muscle tissue. And the last thing I'm going to show you is hip hikes. So what the problem is a lot of time with the hip joint is weakness. A lot of people do not train the hip. They do not do exercises for the hip, so it is the weakest part. And it's the one thing that holds everything together. It's that core. It's part of that core that everybody talks about. So you want to make sure that you are doing specific exercises for the hip. Now, this one we're going to do is called a hip hike. So you can do this on a step. You can do this standing on the floor. All you're going to do is just raise your hip up. And now back down. Now, this is a very subtle motion, okay? As you can see, you can barely notice Sam doing it, okay? Notice her knee does not move. It is not this, okay? Your knee should be in one position and one position only. That's it. And as you do it, you're just going to raise your hip up and back down. This is not as easy as it looks, okay? A lot of people have a really hard time just even getting this motion without putting the knee up and down, without bending it, okay? But it's a very subtle motion. You're going to feel this in the hip that's in standing, okay? So you're not really going to feel anything in the hip that's coming up. You may feel a little bit, but the most common thing, everyone's like, well, why? I feel it with the hip that's on the ground, not the hip that's working. That's the hip that's working, okay? The one that's staying on the ground. That's going to help stabilize your hips. And a lot of times what happens is you need to stabilize your hips. Now you need to also make sure you're addressing any muscle tightness that's in there. We address that with the first 2 exercises. So what you want to do is you want to make sure that you're doing about 30 of these every day. Again, you're not lifting a weight, you're not doing anything too difficult, so it's not I have to wait 48 hours, I have to wait, I can't do these every day. Not the issue here, okay? So finally, that is all for our hip lecture series. So thank you so much for joining in. Kind of as a reward for listening to me babble on for those 3 series, what we're going to do is we're going to give you a free offer of a screen. So if you want to have a doctor of physical therapy, a hip specialist, look at your hip, give us a call, 215-997-9898, and just ask them for a free screen for your hip. Let them know you did the video course, and they will schedule you for a free consultation one-on-one with a doctor of physical therapy to diagnose the issue. Thank you so much for tuning in. If you have any problems, you can reply back to this email. Please join us for our other courses that we have, and we look forward to seeing you.